TV.
Mtazamaji popote ulipo, natumai siku yako inaendelea vizuri. Yangu safi kabisa, na kukaribisha katika NTV Alasiri kuangazia matukio ya hapa na kule. Mimi Daniel Mule na nakuomba uwe nami hadi tamati. Na kumekuwa na mengi ambayo yanazungumziwa kuhusiana na homa ambayo inasababishwa na virusi vya corona, na Wakenya wamekuwa wakizungumzia haswa baada ya kurejelewa kwa safari za moja kwa moja kutoka China kuja hapa nchini, na baada ya ndege kufika hapa nchini ikiwa na abiria zaidi ya 200. Wengi wamekuwa wakizungumzia swala hili. Je, Kenya imejiandaa vipi kukabiliana na homa inayosababishwa na virusi hivi vya corona? Na tuko tukisubiri tu katika Wizara ya Afya. Kutakuwa wakati wote kutoka sasa pale Afya House tutakuwa tukipata taarifa ya serikali kutoka kwa wizara hiyo kuhusiana na kujiandaa kwa Kenya, na pengine kuhusiana na tetesi hizo ambazo zimekuwa zikifungamanishwa na kurejelewa kwa safari hizo za moja kwa moja kutoka China kuja hapa nchini. Kwa hivyo wakati wote kutoka sasa tutakuwa tukienda kule moja kwa moja, kama unavyoona katika picha hizo, maandalizi ya waziri wa afya kutoka katika wizara hiyo ya afya, ikiwa ni kauli hakika kutoka kwa wizara hiyo kwa niaba ya serikali kuhusiana na swala hilo ambalo Wakenya wengi wanalizungumzia katika mitandao ya kijamii, baadhi wakikosoa hatua hiyo wakisema kwamba inawatia hatarini Wakenya ambao huenda wakakumbwa na tatizo la kukabiliwa na maradhi hayo. Kwa hivyo ni mojawapo ya masuala ambayo tunaendelea kufuatilia. Jane Ngweri yuko kule, vile vile Brenda Wanga kuendelea kufuatilia atakayojiri kutokana na hotuba hiyo ambayo tunatarajia wakati wote kutoka sasa, na tutakuwa tukienda kule. Utakumbuka kwamba safari za moja kwa moja kutoka China kuja hapa nchini na kutoka hapa nchini kwenda China zilikuwa zimesitishwa, lakini safari za moja kwa moja kutoka China za ndege za China kuja hapa nchini zikarejelewa, na tayari kuna ndege ambayo ishafika. Hebu tupate kusikia kauli za serikali kuhusiana na maradhi haya ya corona.
I will begin by making some general and overall remarks regarding the coronavirus outbreak and how we are dealing with it. And after my remarks, I will ask the Director General for Health to read a press statement that will outline and inform you about our level of preparedness as a country in dealing with this outbreak. I'm sure that most of you have been following this outbreak very carefully, and I'm aware that you must be familiar with the numbers. But just so that as we start off, globally we know that the numbers of confirmed cases have now reached 81,135, with the majority of these still in China. Globally, the deaths stand at about 2,765 right now. However, we are seeing that the virus has spread to countries outside China. As of today, about 37 countries have reported a confirmed case of the coronavirus or COVID-19. The data also show that the number of daily new cases reported in China has been dropping, and it appears for the first time the number of new cases outside China are higher than the number of cases in China. And I think this points to some level of success in terms of the containment measures taken by the government of China. There is also increased number of deaths reported in 3 countries most recently you are aware of: South Korea, Italy, and Iran. Otherwise, the number of deaths in other countries still remains very low, with only 3 other countries, Philippines, Japan, and France, reporting 1 death. In Africa, there have been reported 2 confirmed cases, one in Algeria and one in Egypt. I give this background because it sets the tone for us on some of the issues that we know have been circulating in the media and in the social space regarding this coronavirus and our own position as Kenyans on how we are preparing for it. What this information tells us is that an imported case of coronavirus can at this point come from a variety of places, and not only from China. Although initially the epicenter was China and the focus on response was in China, it could come from anywhere. And it involves travel and global travel. As you all know, the WHO position has always been that at this point in time, the coronavirus outbreak needs to be contained without taking any action that will disrupt international traffic and trade. However, every country will come to a point where they will have to weigh these factors and make a decision on their own. Let me talk about the Southern China Airlines that resumed its service yesterday. And I stress the word resumed because I want to clarify the misconception that Southern China Airlines stopped their flight because the government stopped it. That is not the position. Southern China Airlines stopped their flight. They suspended their flight on their own volition, voluntarily, and at the time of suspension they made it clear that they were going to have that suspension on for 2 weeks. I think it was on the 11th, that they would have it on 2 weeks, and then they would resume their flights on the 25th, hence the flight that arrived on yesterday. What has happened globally is that the level of screening of travelers has been heightened, and especially in China and other places that are experiencing a high level of transmission of this virus. The Southern China Airlines flights coming out of China go through a rigorous, travelers coming out of China go on their China Air flights and any other flight go through a rigorous level of screening within the airport. Thereafter, they are on the Southern China Airlines, they are screened on board by the crew. During travel on board, the passengers are monitored, and even provisions are made to separate the passengers, and they take all necessary action to monitor and ensure that there are no signs or symptoms that any of these passengers may be displaying. Upon arrival, as you observed yesterday, the team here and the people they work with and our port health team board the aircraft and screen patients, travelers on board the plane. They do the temperature screening, and while in flight, they will have completed a form that states their personal details, their travel history, and so on. And that information is always available to us as a ministry. Equally, at the same time as they disembark, they are also required to fill certain forms that will also give us their information. These passengers coming directly from China have already been prepared in their country that because of the coronavirus and the need to be able to do all that is possible to prevent export of this virus. They have been prepared by their government to be able to undergo a self-quarantine process. And that is what was done when they came here. They went on self-quarantine. The team here informed them about this, prepared them for the self-quarantine, took their necessary details, and they are now in self-quarantine. And I must say that we have enjoyed a great deal of cooperation from the Chinese embassy here, because they have been able to alert us in advance on any travelers coming from China, if they are Chinese nationals. And we have quite a number of them who are coming here because they work for these big companies that are present here. They alert us, give us information about these travelers who are coming here. They give us a record of their travel history, and they then also support them in terms of going into the self-quarantine for a period of 14 days. And I'm sure that all of you understand that is necessary, because we need to know whether these travelers have contracted the disease or not. At this point also, I want to make a clarification, because I think that there is also a misconception in terms of what quarantine means and what isolation means. Quarantine means we want to be able to separate travelers who may have come from an area where the virus is circulating. It doesn't mean that they have been exposed, but they come from an area. They may or may not be exposed. And the idea of a quarantine is because you are not sure, you cast your net wide, you place them under quarantine for those 14 incubation days, in which at what point, if one is sick, they will display symptoms. And then you can take the necessary action. Isolation, on the other hand, is you have already identified a patient who is displaying the symptoms that you are looking for coronavirus, and these are clearly defined as case definition, the fever, the cough, the difficulty in breathing, the temperature. These are the cases that then you need to isolate. And isolation means you separate them within a health facility away from everybody else, so that again you do not allow transmission of the virus. And then you do the necessary tests to confirm, number one, whether the virus is actually present in that individual, and then you manage that individual appropriately through the process. As you all know, coronavirus and many viruses have no treatment. You have to manage the individual, you have to give secondary support until they are able to get through that period. So I wanted to clarify that. And that is what has been happening, and with this China Air flight. We also have recently been able to engage with the Korean embassy just to be careful about South Korean passengers who may be coming into the country. And the same measures that I have outlined here are being applied for those passengers as well. And we will continue to expand these as we see the risk areas and where our traffic flow is coming from. We will take that necessary action. Having said that, I want to say that we as a country have over the last 2 months or so been engaging very seriously in developing our plans and contingency and action plan on how to deal with the coronavirus. A lot of work has been done that maybe has not probably been properly communicated to the media. We have a contingency plan. We have certain action points that have already been taken in terms of preparedness. As you can see, we have instituted measures of surveillance, of screening at all our ports of entry, temperature screening for all passengers arriving from everywhere, with particular focus on those who are coming from the risk areas. We have improved the number of staff, healthcare workers under our port health system who conduct this screening and obtain the necessary information. We have a very active emergency operations center under our Department of Disease Surveillance and Response that responds to any suspected cases or alerts that we are informed about and quickly moves forward to address these alerts. We have built our laboratory capacity. We actually have had laboratory capacity all along. What we didn't have is the specific reagents. For a while, we didn't have the specific reagents for this new virus that are required to identify it. It's an entirely new virus. There was a process of study that had to be undertaken to identify targets that will be able to detect this. We now have those reagents in place, and apart from, I think, three samples that we sent out to South Africa, we are now doing all our samples here at 2 laboratories that have the capacity to do this testing. One is the National Influenza Center under our National Public Health Laboratory, and the second one is under KEMRI. So we have capacity in that area as well. Equally, we are working on enhancing and building capacity in a number of different areas. And I would like at this point perhaps stop at this, because I want to allow the Director General now to be able to read his statement, because it is his statement that actually elaborates on the preparedness measures that we have taken as a country. Thank you. Dr. Amoth, our DG.
Thank you.
Can you move here so that you can?
Swap seats. Thank you, Chief Administrative Secretary, Minister of Health, Dr. Rashid Aman. We'll now read the official press statement from the Minister of Health, and it will address some of the matters that the Chief Administrative Secretary has already spoken to. As at 26 February 2020, globally 81,109 confirmed cases and 2,762 deaths have been reported in China and 37 other countries. In terms of the preparedness measures, the Ministry continues to maintain the heightened surveillance system at all points of entry, health facilities and communities across the country. So far, the Ministry, through its surveillance system, has been able to pick 17 alerts, all which tested negative for the disease. Further, the government has put in place the following key interventions. Number 1, as mentioned by the CAS, the contingency plan. The country has developed a national contingency plan to guide implementation of priority preparedness and response activities in view of the threat posed by importation of COVID-19 into Kenya. Number 2, in terms of governance, we have adopted a whole government approach and a multi-agency approach at 2 levels. 1, technical, where the principal secretary sits, and policy level, where the various ministers sit. Below that, we have the task force, which sits every alternate day. Through these, ministries, departments, and agencies have been brought on board as one government to deal with this threat. Number 3, activation of the Emergency Operations Center. The Emergency Operations Center has been activated and is closely monitoring the evolution of the outbreak across the globe. In addition, the rapid response teams are on standby to investigate any alert anywhere in the country. In terms of diagnostic capacity, as the Cabinet Chief Administrative Secretary has stated, we have in-country capacity to be able to now diagnose at 2 laboratories, at the National Influenza Center under the National Public Health Laboratories and at the KEMRI Reference Laboratories. Number 5 is in terms of screening. Mandatory screening is ongoing at all points of entry to minimize the risk of importation of the virus from the 38 affected countries. As To date, a total of 320,123 travelers have been screened across various points of entry since 20th January 2020. In terms of human resource preparedness, we have trained 615 healthcare workers in both the public and private health facilities and at all points of entry on how to deal with any suspected cases. And we have also deployed additional healthcare workers to the Jomo Kenyatta International Airport, our premium aviation hub. In terms of isolation facilities, number 7, we have an isolation facility at the Kenyatta National Hospital, which continues to be used to isolate suspected cases which meet the case definition criteria for further investigation. The government has also taken over a new ward with a bed capacity of 120 at Bugatti District Hospital to further increase our isolation capacity. In addition, all the points of entry have isolation or holding facilities and are prepositioned with appropriate personal protective equipment. Further, the Ministry of Health has met with the Chief Executive Officer for major private health facilities within Nairobi County to support provision of additional isolation facilities in the event that the country reports more cases than can be handled at Kenyatta National Hospital and now Bugatti. In terms of personal protective equipment, which is also key, especially for the healthcare workers and the support workers, especially at the points of entry like customs officials, immigration officials, the security officials at the airport, we have prepositioned adequate personal protective equipment, including the hand sanitizers, at all our points of entry. The ministry advises members of the public to remain vigilant as the risk is still high and this is a rapidly evolving situation, and to continue taking the necessary precautionary measures by maintaining basic hand and respiratory hygiene, safe food practices, and avoiding close contact with people suffering from acute respiratory infections. In addition, anybody showing symptoms of respiratory illness, such as fever, coughing, difficulty in breathing, and sneezing with a history of restaurant travel to the affected countries, is advised to visit the nearest health facility for assessment and prompt management. Further, we would wish to advise that all non-essential travel to the affected countries be effected by Kenyan citizens. To further confirm our preparedness, I have here information from WHO Afro region, which was published on 13th of this month, looking at 2 key areas. One was preparedness. You can see the countries in green: Algeria, Cote d'Ivoire, Cameroon, Kenya, Ethiopia, Tanzania, and Madagascar. These countries were rated green in terms of the measures, preparedness measures that they are put in place. In terms of ability, again, of the countries to be able to test for COVID-19, and I'll be able to share this with you. Again, you can see Kenya is in the green shadow, meaning that we have local capacity to be able to test for the virus in country. Thank you. You have to come.
Give you a chance to ask questions, but please stick on the agenda of the day, coronavirus. So please tell us your name and your media house before you ask the question.
Okay. My name is Gloria Milini from K24. Dr. Amos, you talked about the government taking over a facility, a ward at Bugatti District Hospital. And from the previous press statement issued on 13th of February, you said it's 120 bed capacity. Today I visited the facility and it's just a building. So nothing going on, it's just a building with old equipment. yet to be used. Maybe if you can clarify on this ward that you've taken over as the government. And then you've talked about self-isolation. So who is monitoring to ensure that those who are self-isolating are actually doing this? Because you've seen on social medias, guys even just complaining, saying that they have neighbors who allegedly were part of the 239 passengers who came in from China, and they are mingling freely with the public. So how safe are members of the public, if you can just address those issues?
So we can take another one.
My name is Jane Gweri from NTV. Had the time saying that Kenyans should avoid traveling to that question, right, to those countries. My question is, why not impose a travel restriction? Why not just deny access to the Chinese from coming to Kenya? Why are you putting the lives of Kenyans at risk?
Any other? Graham?
My name is Graham from the Standard. What I would like to understand is how can you convince Kenyans that the measures you put in place are going to work, considering that other countries which have better medical equipment, better advancement in medicine, actually blocking. They don't even, like Russia doesn't even want to see the Chinese around the country, around the airspace. But Kenya is so much welcoming, yet we are not so sure of how advanced our medical system is to handle such affairs.
So maybe they can respond to that before we take
Yeah.
another round.
Let me respond to that, and I will ask my colleagues if they want to add anything on it. I think the first question was regarding the Bugatti ward. The Bugatti ward is when we...
Please, sir.
You can't
Speak
hear?
up, we can't hear you.
Okay.
Thank you.
The Bugatti ward that the government has now taken hold of is indeed a building that was intended for other purposes, and as a national government we took it over because it serves our purpose of setting up an isolation facility there. So there is work to be done in terms of creating those spaces, creating the spaces for the divisions, so that we can have the 120, and the capacity is 120 beds. That work has been planned for and is actually in the works. We are going to start to do that in the shortest period of time. We should have that facility up and running and ready to receive any cases that turn out to be positive for this. So it's work in progress. We are speeding it up. It will be there.
Any duration? Dates?
We are on a fast track mode. I think we have set ourselves that within the next, certainly within the next 1 month or so, we should have that facility operational. In the meantime, we have 11 bed capacity at Kenyatta National Hospital. And I think that is enough for us right now to deal with any situation, unless we get a increase in the numbers, but we think we can meet that target and have that facility ready. With regard to self-quarantine and what it means to self-quarantine. Self-quarantine means that the individual must remain indoors and away from other people. And I think all of these passengers who are coming from China, and especially those who are the workers, because most of them are the workers working with the companies here, they have very strict instructions on how to do it, and most of them are doing this with fidelity. We know this because the embassy, we know this because we work closely with the Chinese embassy, who also helps us monitor. And again, to answer that question of who monitors, this is the work of now our teams, our response teams, both here at the national level and also linked to our county health systems, where we have cases in the counties. There is a linkage system where immediately, if there is information coming from the counties, it is linked to the response team here, who are then able to go and assist the county team on how to deal with it, or go down there and deal with it. Okay. So those systems are in place. About mingling with the crowd, I know that there is a lot said. I cannot say what is true and what is not true, but the measures that we put in there, we make it quite clear that for the system of self-quarantine to work, this is what must be done and must be observed. 14 days of quarantine.
So during these 14 days, what do they do? What is expected of them?
Self-quarantine means you remain indoor and you monitor yourself. If you have any symptoms, they have information on who to contact or call, and then they will receive that medical care. But the team also have their contacts, and they call them periodically to find out how they're doing.
Actually, with the case in Kitui, I was there, and then these Chinese they came all the way from JKI in a car, all the way to Kitui. In terms of contact tracing, what are you guys doing? Because as much as these people will self-quarantine, then what becomes of these taxi drivers? Is there a procedure for contact tracing?
Yes, there is a procedure. There is a procedure where this information is supposed to be recorded, both by the individual themselves and the team who will be sending them in a taxi or wherever. Sorry, I'm very sorry. I know this is where the cameras are. Okay. Yeah. So there are procedures that will be able to collect all the necessary information. In fact, not only from the point of travel within the country, but even within the flight, in terms of where they are seated, who their closest fellow passengers were. There are explicit procedures that record that information so that you can be able to monitor and track those individuals in the event that an individual turns out to be positive. That is the way we track, and we hope that we should work. I am coming. That was number 2. Your question, together with the question from the standard gentleman, raised the issue of why don't we, basically what you said is why don't we just stop the Chinese from coming in? And I think that is a discriminatory approach, given now how the virus is spreading in many different countries. I started off by telling you the changing pattern of this virus. It doesn't mean because somebody is coming from China that they have it. I don't think anybody would want to be labeled that because you come from somewhere, you have this virus and we need to bar you. I know some countries in the early phases when they evacuated their personnel and they had seen certain cases in their country, they did exactly what they did is they closed their borders and did not allow anybody coming, and not only Chinese, they said anybody who has come from China, a history of travel in China, would not be allowed in. I think the USA is one of those countries, except their nationals, whom they then put on quarantine.
Well, what would you tell the parents of the children in Wuhan and the government said clearly they're better off in China than coming back to Kenya? Yet they're Kenyans, but the government is allowing Chinese nationals to
Let me tell you something which I think sometimes escapes us. What is happening in Wuhan and Hubei province, Wuhan city and Hubei province, is that there is a lockdown. Lockdown meaning that nobody is allowed in or out. And that lockdown has been in place in order to bring down the transmission of the virus, because that is the epicenter. And we're beginning to see that there's some level of improvement in that area. So let's not talk about bringing, because it's a lockdown and people cannot travel freely. But these other Chinese nationals and even Kenyan nationals and others who are coming in, they're coming from other parts of Kenya where there is of China where there is no lockdown.
But other countries like Italy has moved their nationals from Wuhan.
Yes, several countries have done that. Yes, several countries have done that. We are now moving into the area of the students and evacuation, which I would not want to address because I think Ministry of Foreign Affairs should be able to address that. That's the issue. But with respect to travelers who are coming in from China, even if you stop flights coming in from China, flights come in and connect at different places. We have Ethiopian Airlines, we have Emirates, we have Qatar, which are active in that region in general, and they bring in passengers through transit. So it is not a solution to solve the problem now. A point might reach where that may be necessary. Yeah? But I think we should be careful not to label people in a certain way. I think it would be dangerous to do that. Yet we must always be careful that we are protecting our people as well. I think that is not lost upon us. We want to protect our people at all cost. Okay?
So, any other question?
Yeah, my name is Joseph Maya from Capital Fair. I'm just wondering if at all the government has a mechanism to monitor these people who are under self-quarantine. Have we mapped out? Do we know where these 239 Chinese are?
Yes.
And
Yes, they are known, their contacts are known, where they are staying is known, both by us as well as the embassy, Chinese embassy. We have their phone numbers and contacts.
And immigration.
As well as immigration, the Department of Immigration also collects the information. So we have this information and we know where they are and we monitor them, both as a ministry, the county level as well, and the embassy themselves. Call these people very regularly to find out what their condition is.
what will happen to some?
By the way, this
Chinese-
quarantine, although we did it, this was a mass quarantine because of the flight, now the direct flight that came from China. But we had put this self-quarantine measure even earlier because Chinese nationals were still arriving on other flights. And the embassy worked with us in terms of imposing this self-quarantine. And it has worked fairly well up to now.
Yes, so talking of strict measures, what
Yeah.
will happen to those who might? Because there are concerns, including by MPs, that there are some Chinese who are freely mingling with Kenyans, yet they're supposed to be in the houses.
No, but you see, we can't say, because if this Chinese has has no history of travel in the last 14 days, there's no reason to say that that person is a risk.
From the flight that
Yeah,
came yesterday.
but this one of the flight, that is information you are telling us. We don't know, but if it is happening, it is something that perhaps needs to be corrected and set right. But we have taken those measures to at least make sure that they're there. In fact, the Chinese ambassador himself said that he will, if there are any defaults, be able to follow up. Because most of the Chinese are living in these work camps where the companies are, the construction companies, the water
Let's
companies.
take two more questions.
All right.
Yes.
Captain Kabu from Citizen. Probably just let me start from there. These people are doing self-quarantine from their houses, from their homes, where they have fellow family members. At the end of monitoring, are they being monitored, the rest of the family members? Secondly, is this our own invention or is also being practiced in another country? And then thirdly, is it true that a Kenyan is tested positive in Vienna?
Okay. Okay.
From the same media and the same.
Yes, we're with CNN. In good form. The question about the case of monitoring. Number one, were all the passengers on that flight Chinese nationals? We understand there were Kenyans there as well. How exactly do you monitor them? Because you don't understand there's measures in place. So far you've told us that it's the Chinese embassy helping you monitor the Chinese nationals. What about Kenyans and any other nationals? On the airplane coming over, who does the monitoring there? And also, as you very well know, Kenya has been identified as a high-risk country by very significant international institutions and publications. As the highest risk country in East Africa, will you continue these flights from an area that's not the highest infection rate in China, but the second highest? Will you allow these flights to come in?
One last question.
Well, mine is on From Hope Media. Mine is, well, we are making these people self-quarantine. And the basic aspect of any Kenyan who is on mobility is on basic assets that they need. How is the government doing and what is the government doing in the provision of other amenities that the people need for them to remain indoors for the next 14 days?
Okay. Let me start with somebody asked about self-quarantine, cargo is it?
Yes.
About self-quarantine and how we monitor? How we monitor this?
Monitoring.
Yes. Monitor is, as I said earlier, we have rapid response teams here. We have our emergency operations center. We have, if it is within the city of Nairobi, this is the team that monitors. They make calls, they may even visit the subjects. So that system of monitoring is there. It extends into county level for those who are outside Nairobi and within the counties. That monitoring level extends now to the county health authorities there, who under the guidance of the emergency response teams here are able to monitor. Okay? Now, your question was regarding family and whether there are standard guidelines. There are standard guidelines on self-quarantine issued by WHO. If a person has traveled and is going back to his household where there is family, self-quarantine means he must isolate himself also from the family within the house. He must remain in a particular room and not allow that contact, because that transmission can happen. In that case, then, that is the person who is under self-quarantine, as long as he observes those conditions of not freely mixing with members of his family within his household. Because of the way the virus is transmitted through close contact, through air droplets and so on, he will be the quarantined person. However, if he does mix with his members of his family, then the entire family is under quarantine. Okay? Now, many of the Chinese who are coming here as workers live alone. So it is not an issue. They self-quarantine in their facilities on their own. Okay? The question from CNN was, how do you monitor again, isn't it? I think I have answered that in terms of the monitoring process.
We don't understand how an individual, it doesn't have to be Chinese, any nationality, Kenyan, businessman coming back from China who has goods to sell, how is this person monitored? How do you
in the same way, the person is instructed that he is given strict instructions according to these guidelines on what to do. Go home, do not leave your home. If you have a family, isolate yourself, and for 14 days.
So it's an honor system, basically, you're relying on.
It's a
honor system. You trust
well,
the person to do this themselves.
There is a level of that, I would say, yes, because people have to be careful about their health. If it were me and I had a family, and I was told that that was the option, of course I would isolate myself and not pass the risk on to members of my family. But there is the monitoring system where, you know, the individual is asked to continuously monitor himself, to check his temperature. If he feels a fever, if he feels anything, he contacts the medical team, and then they are able to come in and provide the services that are required or take the necessary action. This might even mean taking samples now to find out, does the patient meet the case definition criteria, and if he or she does, samples will then be taken to confirm whether it is this coronavirus 19 or not.
And the nationalities on the plane?
Nationalities in the plane, we had 239, 198 were Chinese, 30 were on transit. 30 were on transit, 30 wasn't it? Yes, yes. 30 were on transit, so they just transited through. And the rest were the crew.
So no Kenyan nationals?
13 Kenyan.
13 Kenyan. And details are also available.
And the last part was, will these flights continue as Kenya being identified as
we are monitoring very carefully what's going on and how it is spreading. And there are discussions about this. At this point in time, I'll say that the discussions, very, very serious discussions, are happening. And if a decision is to be made, it will be a government decision that involves, all the different relevant ministries. Yeah. So.
Apart from self-mentoring,
The Vienna question.
Yes, Vienna.
We are checked with the Foreign Affairs.
Yes.
There's nothing like that.
I am informed because earlier on we were told about this. My colleagues say they have checked with the Ministry of Foreign Affairs. They have no information of this case in Vienna. So we have no official information as of now about this case.
The self-quarantine, is it Kenyan invention or something?
No, it is international practice. As I said, the WHO has a guideline. Many countries have implemented it, from Australia and many others have implemented the self-quarantine mechanism. Remember, the self-quarantine is an extreme precautionary measure. When somebody is quarantined, it doesn't mean that that person is sick or even exposed. It is simply because that person is associated with travel from an area where the virus was circulating, that you do not want to take any chance, but you want to keep that person separated, allow the 14 days of incubation to elapse to determine whether that individual is infected or not. So it is an extreme precautionary measure. Okay?
Thank you. One last point. My name is Brenda from NTV. With the level of mistrust and anxiety in the country caused by this coronavirus outbreak, couldn't it have made more sense for the government to just isolate these people for these 14 days instead of releasing them to the general population, just to calm down the fears? What would that have cost the government?
Okay, first of all, I want to correct you about isolation and quarantine. And again, that is some part of the thing that is fueling this misconception. Because when you talk about isolation, you are talking about somebody who is carrying the virus. So these
people who have actually been confirmed positive after 14 days of incubation.
Yes. Those people, yes, positives is...
After they've been released after 14 days of incubation, over them, a case is confirmed.
A case will be confirmed within the 14-day period if there is indeed a case, because the symptoms will have developed, and what we call the case definition symptoms, because it's not just any symptom, it is particular things that must happen together. And once that happens and a test has been done that shows the virus is actually present in those fluids from the nasal, from the nose and other parts, then that person is now what we call a confirmed case. The person is carrying the virus. That person then must be isolated in a hospital setting and must be supported and given the appropriate treatment to recover. By the way, this virus, although it spreads very fast, in terms of its fatality, it is rather low compared to some of the other viruses that have come out in the past. I think the case, what we call case fatality rate for this virus is in the range of about 3 to 4%. Most of the people will recover. Some will have a severe disease for a while. They may recover, but about 3 to 4% will succumb to the virus. So containment and prevention of spread is what's important. Prevention of spread. Because you can imagine the costs and of containing people who have contracted the virus. We're talking not now about quarantine now, we are talking about isolation of large numbers of people. This is what happened in the epicenter in Wuhan in China. So yes, it is. If it gets to that stage, it becomes a very, very costly exercise. It will impact on society, it will impact on the economy. So we hope and we pray we don't get to that level, and that we will continue to put these measures and to strengthen these measures that we have put in place. Thank you very much.
Na mtazamaji, ndivyo hivyo basi, kama ulivyoona hapo taarifa kutoka kwa Wizara ya Afya kuhusiana na homa hiyo ya COVID-19, ukipenda virusi vya corona ambavyo vinasababisha homa hiyo. Na wamesema kwamba taifa la Kenya limejiandaa kukabiliana na hali yote ambayo inaweza kutokea hapa nchini, wakisema kwamba hata shirika la afya ulimwenguni pia lina imani na taifa la Kenya kuweza kukabiliana na virusi hivi iwapo vitafika hapa nchini. Na pia wamezungumzia mikakati mingi tu ambayo serikali ya Kenya imeweka ili kuhakikisha kwamba inakabiliana na hatari yoyote ili kuzuia kuzuka kwa homa hiyo hapa nchini, kuwepo kwa vyombo vya kisasa vya ukaguzi na kuongezwa kwa idadi ya maafisa wa kufanya ukaguzi katika sehemu zote za kuingia hapa nchini, ikiwa ni kwenye mipaka na pia katika viwanja vya ndege, na vile vile kuwepo kwa maktaba ambapo uchunguzi unaweza kufanyika na kubaini wapo yeyote anaugua maradhi haya. Manake awali sampuli zilikuwa zinatumwa Afrika Kusini, lakini kwa sasa wanasema kwamba wana ule uwezo, na watu 17 tayari wamefikishwa pale wakihofiwa kuwa na maradhi hao na kuthibitishwa kwamba hawana, kumaanisha kwamba taifa hili limejiweka katika hali sawa. Na kuhusiana na ile swala la self quarantine au kujitenga mwenyewe, ni swala ambalo wengi wamekuwa wakizungumzia, na serikali imesema kwamba yule ambaye anatakiwa kujitenga na yule ambaye anatoka katika maeneo ambayo yana hatari, ambao tayari kumekuwa na homa hiyo, na anatakiwa jitenge kwa siku 14 ambazo ndizo siku ambazo homa hii huchukua kabla ya dalili kuanza kuonekana. Na mwataka wa Kenya kuwa waangalifu, kujichunga wenyewe na namna ambavyo wanaingiana na wakazi wengine, wakisema kwamba serikali kwa upande wake imeweka mikakati kabambe na mikakati ya kutosha kuhakikisha kwamba homa hii haifiki nchini, na iwapo itafika basi itapata kukabiliwa. Kuna mengi tu ambao wamezungumzia, na mwenzangu Jane Ngwira atakuwa akituletea kwa kina zaidi katika taarifa zetu za saa 1 ambazo zitakuwa zikikujia saa 1 hakika. Kwa hivyo tutakuwa ukipata mengi zaidi wakati huo. Kwa sasa nasema shukran na ambao tulikuwa nao katika wakati huu alasiri. Mimi ni Daniel Mule, na kwa niaba ya wote ambao wamefanikisha kukuletea matangazo haya moja kwa moja nasema shukran na kukutakia wakati mwema. Tukutane tena mwendo wa saa 1 leo usiku ambapo Harith Salim atatuletea NTV Jioni.